board-certified plastic surgeon in Beverly Hills. And as I understand it, Doc, you've been in surgery all day. So thank you so much for taking the time to speak with us. I hope you're going to get some sleep tonight. So let me just ask you about the first question, and that's the ethics of operating on your own family member. What is the story there?
Well, ethically, it is unethical to operate on a family member. That's just hands down. And there's some rare situations like emergency situations where obviously that doesn't apply, but it makes the most sense, if you think about it. There's an emotional bias. It's the same as like, if a judge is ruling in a case that a family member's in. The same thing applies for medical professionals too, because your judgment could be biased or could be affected by the fact that a family member is the person on the table.
So the other issue I wanted to ask you about was Hillary's father believes that her husband knew exactly how long it would take for lidocaine toxicity to sort of take hold. I'm not a doctor. I don't know if Hillary's father is a doctor, but you are. Does that add up?
Yeah. Well, it's difficult to speculate that. There's a lot of things that we may or may not know, and ultimately, it comes down. Is going to come down to a thorough investigation. But lidocaine toxicity is a very sneaky onset. Blurry vision, that could be from just low blood pressure. Twitching, things like that. Lidocaine toxicity is not the most overt thing. Now, someone who's trained like an anesthesiologist, I mean, when I do surgeries for patients, I have an anesthesiologist in the room whose number one job is to be focused on the patient and any of those signs and symptoms, and they're trained. Now, I'm also trained for these types of things, and I do occasionally do procedures under local, which means that it's just me and the patient doing the procedures. But you have to be able to be aware of lidocaine toxicity, especially on a large amount of procedures that she had. And if you're not, you shouldn't be doing these types of procedures.
So there's other allegations from like medical assistants in that practice that things were not operating as they should. For instance, like doctors not wearing masks during surgery, wearing jewelry and big watches under their gloves, that it wasn't a sterile environment, that staff members were left to finish off procedures, and even the allegations in the court documents suggested that Hillary was prepping her own IV bags, and actually, I couldn't believe this. I had to ask twice. Finishing up her own sutures on the earliest of these procedures this day that things went south. I'm assuming your answer to all of this is holy cow, but tell me a little bit about a practice that operates like that.
It's a practice that shouldn't be in existence. I read through some of the allegations as well. The place was reported to be dirty. He couldn't find his stethoscope. There was a lot of things that happened. I go to a surgical facility to do my surgeries and my procedures, and there's an accreditation that happens every 3 years, or even sooner in some situations, where you have to have medications available that are not expired. You have to have the stethoscope. You have to have a crash cart. You have to have proper training. You have to have the level of training of people that are actually going to be in the room. Every state is slightly different, but a nurse versus a medical assistant, the patient preparing their own medications is so outrageous. She was not even medically trained. There's all types of things that could happen in that situation, and there was parts of that allegations where he was trying to figure out what pills that she took, according to the medical assistant that reported it, and that's a big no-no too. There should be a medication reconciliation that happens anytime a patient comes in to get a procedure. You need to know exactly what medications have been taken.
Dr. Daniel Barrett, I'm so appreciative for your wisdom on this one, and I'm sort of gobsmacked by all the details that I've been reading. He is, again, innocent until proven guilty, but appreciate your wisdom. Thank you, sir. Get some sleep.
Absolutely. Thank you so much. Have a good one.
You bet. We'll have you on again. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.